This last is not really a full panel. It's just brief remarks, some takeaways from some key stakeholders who really were very instrumental in getting this whole line of thinking going, and I think are going to be also extremely influential in moving it forward as we take the ideas, the research hypotheses that have been generated and buzzing around in people's minds, and hopefully people in the audience will be inspired to take them out and do the research and lead to the useful findings. So they're just going to summarize from their different perspectives some key takeaway points that they want to just kind of send us away with. We have on the panel Richard Lucas, who is the Deputy Associate Administrator in the Office of Policy Support for USDA's Food and Nutrition Service. So in this position, Rich is charged with the job of coming to work every day, thinking about how can he make these programs, which are so important to the well-being of so many people's lives, more effective and efficient. And to the extent that, behavioral economics can add to that, he will add a few remarks on that. And then next is Jay Varium, who is the Division Director of Food Economics for USDA's Economic Research Service. And Jay really has a long history at ERS in thinking about how behavioral economics can influence food behavior for the better, and leading our research program in this area. And again, he'll add a few remarks on that. And then finally, Tracy Fox, who is the President of Food, Nutrition, and Policy Consultants, an important and influential person on our Washington nutrition policy scene here. But also today she's speaking on behalf of the Robert Wood Johnson Foundation, for whom she often provides some important consulting services. And the Robert Wood Johnson Foundation has really been such a key group in bringing together the organizations that form NCCOR, in sparking a lot of this dialogue, in furthering the research connections. And so I think, again, their takeaway will be really important on this topic. So at this point, I'll turn it over first to Rich. Thank you.
Thanks, Joanne. I know it's going to be hard to fit all of this into the next hour and a half, but I think it's going to be... No, actually, our guidance, I think, here is to be very brief, and I will do my best to do that. I first just want to thank the folks who worked so hard to put this together, for the opportunity to have this discussion and hear from so many different folks about these new ideas that I think are going to be important for the future of SNAP and its role in supporting and motivating healthy diets, which is a critical part, obviously, of the program's mission. There's so much creativity and energy going into the efforts that we've heard about today, and that's very exciting. But I think at the same time, what we've heard about the evidence data is also very sobering, because it has helped me recognize in a more concrete way what a complex puzzle this is. And it's in two areas that I saw it, both in terms of SNAP participants, SNAP shoppers, and in terms of retailers. And folks have kind of described in different ways both similarities and differences between SNAP clients and other shoppers. It seems to me that fundamentally the kinds of dietary improvements that we're seeking are the kind that almost every consumer in the United States could stand to make, and that's clearly a similarity, although folks did identify that there were some places where SNAP participants tend to do somewhat worse, and we don't know the direction of causation on that, whether, folks who are doing less well are also tend to participate in SNAP, or there's some causal link, but it's important to keep in mind that there are differences there. But I think that in addition to those things, there are a bunch of challenges, and we've touched on them in the course of the presentations today, that are unique to SNAP clients and to low-income households in general. And a couple of people summarized that obviously the income limitation is important, limitations on time, and the ability to reach stores either because of transportation challenges or because of food access issues, just as a result of the geography of the retail environment. But I also think that we need to put that in the broader context that very low-income households, and SNAP households are very low-income households, have multiple challenges in many cases that are reinforcing, and it's just part of the difficulty of being poor in our society. And I think as we think about what we're doing to motivate these behavior changes and cut through the multiple messages that are out there, we need to be thinking about the full experience and the balances that are being made by SNAP clients. So, and I think doing that, behavioral economics is great for this, because I think doing that in ways that keep SNAP shoppers or any consumer sort of in the driver's seat, that they can attribute this change to their own choices, is really important and empowering. So that struck me also as an important takeaway. Sort of the insight that this is not just about nudging SNAP shoppers, but about nudging retailers is one that really came home to me. Traditionally in nutrition assistance policy and SNAP policy and other policies, we set standards, and they tend to be requirements, but then we also work with our program partners in states and localities to promote best practices and use flexibilities within those requirements. And it seems to me that thinking about the retailers who redeem SNAP benefits as our partners in that context, and with both of those kinds of levers, how we shape the requirements for retailers, and the Farm Bill did require some changes that will have forthcoming regulatory action to change the eligibility standards for SNAP retailers to make changes to the depth of stock, but also thinking about the kinds of changes to the store layout, the store environment, and all of the various kinds of nudges that we've heard about here today. I think it's something where you may or may not see those in a regulatory action, but we certainly could imagine promoting best practices, identifying the ones that are most effective, and helping to get them moving. But I think fundamentally what struck me about this whole issue is the fact that in order to make this, as I guess it was Dr. Beatty mentioned, so the current retail environment is an equilibrium outcome, and it reflects the fact that folks are looking to maximize their profit margins, and we're not going to change that. But within that, if we can change the influencers of that factor, and folks talked about all the different ways that retailers are trying to make healthy choices more available, but at the same time we know that there's an awful lot of food that is not so healthy that is actually still being purchased. If we can use that to sort of leverage and push that incentive structure so that the new equilibrium will also do more to promote the health of our clients, I think that's the win-win we're looking for. And the last thing I'll say, because I'm sure I've already gone on too long, I appreciate the emphasis on strong evidence and rigorous evaluation folks have been talking about here today. Even small changes in the SNAP program cost a lot of money. And so it's important that we have really solid evidence about what the impacts of any change we would consider making are. So one thing I should mention is that we talked a little bit about funding opportunities. SNAP-Ed funding that's available, the obesity prevention grants that states get, that can be used both for interventions and for evaluation, and we encourage rigorous evaluation as part of that process. So just to make a pitch for that. So rigorous evidence, pile it high and watch it fly. And with that, I will turn it over to Dr. Berry.
Thank you, Rich, and thank you, Joanne. So, takeaway from this, in conceptualizing this workshop, one thing we thought about was, in the beginning was, getting to know the incentives of all the players so that the intervention can succeed. So it's not just about the SNAP shoppers or the low-income shoppers, but it's also about the supermarkets and the retailing industry as well. And that's critical, and it has come forth very clearly in this presentation, starting with the very thoughtful, thought-provoking presentations from David and Tim. So that kind of laid out a very good framework to start thinking about these things. And I think overall the workshop succeeded very much in bringing all these efforts that are going on, the variety of challenges that people face in doing these kinds of interventions in different type of venues, If you look back at Tim's presentation, it presented the kind of the classical analysis of the incentives and the equilibrium. And then also, store managers in the results about store managers survey, it's like they are not convinced that some of these nudges work. But then to do that, to convince that, as some of the other presentations later showed, show me mentality, which is that you need the evidence, and then perhaps that can convince them. And then also, especially in these smaller convenience stores, where they may be individual stores and so forth, which are an increasing part of the purchases of SNAP shoppers. So the sort of the amazing thing is that despite these sort of challenges in a retailer being ready to accommodate these designs and so forth, so many are cooperating. And as several of the people have already shown, they're having results already coming out. So that's a very positive sign that going forward, some of these interventions can be really tested out. And one other takeaway, speaking from a larger point, is the importance of replication. For the funders, especially in this field, of behavioral economics and consumer behavior change based on these psychological factors. Because if you look back at social psychology, recently there has been a lot of debate on replication. So some of the results that were kind of sounding amazing could not be replicated. So there's a whole debate going on in that field. Now, the good news for the behavioral economics field is that when they tested out something like 19 biggest studies, the key ones that did pass the replication test were done by Kahneman and others based on the notion of the defaults and so forth. So these are based on sound theory and sound experimental evidence, but then actually to try them out, you need to make sure that these interventions are compatible with the incentives of all the players. Otherwise, we won't get the results. So I think the workshop has really succeeded in bringing this, and I just want to single out Lisa Mancino and Joanne Guthrie, who put together this, along with the NCCOR working group who worked with them, and also the NCCOR Coordinating Center for putting together this great workshop. And I also want to thank our FNS colleagues, Rich and others, who actually made this possible, at least from the ERS point of view, through the collaboration and also funding, which is always needed. So I'll stop at that. Thank you.
Thank you, and I also want to reiterate thanks to Joanne and Lisa for asking me to participate, and also to NCCOR. I think this is a really good example of a model of collaboration, and I know the foundation is really thrilled to be a part of NCCOR and has been since its inception, and they're really, I think, are very happy with, especially with something like this workshop where you see all that's going on and all that hopefully will be coming down the pike. And I really thank Rich and Jay for ceding their hour to me, so I'm really looking forward to closing out at around 6 o'clock. And no, actually, we'll try to be quick. I think Rich and Jay really highlighted a lot of the takeaways that I got as well. What I really want to focus a little bit on is looking to the future in terms of funding opportunities, in particular, a funding opportunity that's going to be coming down the pike from the Robert Wood Johnson Foundation. So RWJF is committed to this space in terms of really trying to look out and expand on some of the findings that we've learned about today in terms of healthy in-store marketing practices. And ideally in the fall, I really hate to give a timeline because I've worked in the government as well, and I know whenever you say something's going to happen, it's usually about 3 years later. I don't think it's going to be quite that long, but I do think that there is going to be some funding this fall that the foundation is going to be putting towards this space, in particular, healthy in-store marketing, and it's probably going to be about $800,000, which I know in the scheme of things isn't a lot. So you're going to hear the term collaboration and blended funding sources and all those important things a lot, because we know that there's a lot more funding that really could go into this exciting area. But basically, they're really interested in looking at creative approaches and collaborations. And I think because of that, some of the projects, or probably just about all of the projects that they would look at funding in this space, are going to have to show a combined effort and collaboration among researchers and retailers. So that's something that we've heard about today, the importance of getting that buy-in and getting that commitment, and that's going to come through in the requests for applications. So I'll just talk a little bit about, and again, this is all in the formative stages, and in fact, this session today, this workshop, and then the workshop that NCCOR also hosted a couple months ago, has really provided me, and I know the foundation, with some great points of contact and great ideas in terms of what to expand upon with that $800,000, what to really seek to learn a little bit more about. So I think you can guarantee that many of you we will reach out to kind of get some initial thoughts on, if you were to be thinking about funding something in this space, what would it be? And so would hopefully have a laundry list of different things that you all and the experts have identified as, you know, if I just had a little seed money, or if I just had a little bit more, I'd really like to expand on X, Y, or Z. So we want to make sure that what is funded is pertinent, it's appropriate, it's going to be useful to you all, and also importantly to policymakers. And we haven't really, I think one thing the foundation will think about doing is developing sort of a set of guiding principles to help guide decisions about funding. And while these aren't cast in stone and these are just preliminary, here are a few that we're kind of thinking about, and that is the foundation has really embraced a culture of health philosophy, and that is to make sure that people, especially low-income, low-resource, high-need communities, have access to healthy choices regardless of where they live, work, play, pray, and in this situation, sort of regardless of where they shop. So I think you'll see that theme woven through a lot of the information that comes out about this grant and a lot of the work the foundation's doing. Priority populations are going to continue to be a priority for the foundation. So projects that specifically look at SNAP and WIC and other priority populations are certainly going to be ones that the foundation is interested in funding. And there's also a real emphasis on, which we haven't talked as much about today, but bridging health and healthcare and prevention. There have been some really good examples of retail chains really partnering with insurance companies, et cetera, to really kind of make the link between health, healthcare, and purchasing. So those are areas of interest to the foundation, and always building the business case. We know from Hank Cardella's work and others, there is a business case to be had for healthy marketing, and that's going to be something that I think the foundation's really interested in pursuing as well. And so I don't know that there's, I think Rich and Jay did a great job of highlighting some of the areas that I was thinking about based on today's meeting, that I hope that proposals come in to expand on some of the questions that have been raised. But a couple things. First, I really want to know if the message of don't do it until you're 18 works. I think that's a really brilliant. And then tell them they might get blind or something. I think that will be that would just cinch it. There will be fruits and vegetables flying off the shelf, I'm sure. That's Tracy speaking, not the foundation, just to clarify. I think that there is still a question about what is healthy in-store marketing. What does it mean to really promote healthy foods in the grocery store? Is it really promoting just fruits, vegetables, whole grains, low-fat dairy, or is it also promoting, to Allison's point, the frozen banquet dinner? Is it looking at the healthier lines within that line, or is it really just focusing on what we all consider the dietary guidelines foods to encourage? So I think there's some questions out there in terms of, do you go for the lower sugar Pop-Tart, or you just say, no, Pop-Tarts are totally off the chart? I think those are the kinds of things that I think would be interesting to kind of ferret out. And again, it could be something that is going to be different based on the situation that you're in. And I do like the idea of teasing out a little bit the intersection of behavior economics, nudge strategies, and nutrition education. I think we've talked a lot about some of the different parts of that, and is there is there a model where the behavior economics and nudge strategy works better when complemented or layered with nutrition education, or is that just not a factor in terms of getting consumers to make healthier choices? So ferreting some of that out, I think, would be really interesting. And I think Rich mentioned, and I know the Undersecretary talked about it this morning as well, and it's been mentioned throughout, the retail stocking changes that are coming down the pike as a result of the Farm Bill, and FNS hopefully will be issuing a proposed regulation. And I know, having worked at FNS before, having worked on regulations, I think it'll be really important for you all and others to weigh in to FNS what your findings are in terms of depth of retail, depth of different products on the retail shelf, et cetera, because they need that in order to finalize a regulation that is good, that is strong, that really gets to ensuring that there's a healthier retail environment for SNAP participants. So now is the time to even start doing some of that research to then feed into USDA as they're working through the regulatory process. And I don't think that there's anything else I could add on top of what Rich and Jay already said. I think that they also outlined a number of areas, but stay tuned. We will be reaching out to a number of you for your input on how best to guide the funding efforts, but I do think because it's not much funding, there's also going to be a lot of room for collaboration. Rich talked about SNAP Ed dollars. It would be great to see a proposal come in that looks at identifying some of the RWJF funds as well as SNAP Ed dollars, and maybe the PBH has a grant program. Maybe that can be part of a larger program. CDC has some evaluation money, so it would be nice to see a proposal that builds on a number of the funding streams out there. So, sorry, Elaine, I know you came up, and so with that, I'll end. Thank you.
I want to thank our final panel, and also thank everybody for coming today and providing your insights. It seems like they'll be guiding everybody in the NCCOR family in a really important area. And on that note, as Elaine said, we hope you've been jotting down your comments, your questions, your inspirations, and if you can leave them at that back table, that would be, as you go out, that would be really helpful. We'll just collect them.